Good evening. 3 young doctors working in the A&E department of a London hospital have issued a stark warning to Britain on the day the death toll from coronavirus rose by 87, the biggest daily rise so far. 422 people have now lost their lives, but the doctors warned that they are seeing people in their 20s and 30s who are very sick, and they said that the surge of cases was only just beginning. They urged everyone to take the government's new restrictions very seriously. Today it was revealed that a new field hospital is being opened next week at a conference centre in East London that can take up to 4,000 patients. And the government has launched a volunteer scheme to recruit 250,000 people to help vulnerable people cope while they're confined to their homes. With the latest this evening, here's our health editor, Hugh Pym.
We are standing at the foot of the mountain and we are looking up and we don't know where that summit is. We don't know what we're heading towards.
3 doctors at a London hospital tell me what they are now seeing daily on the front line.
Patients in their 20s, patients in their 30s. We don't know what the outcome of some of these patients will be. They will go to intensive care. They may be in intensive care for some weeks, and some of them will die. And it's completely heartbreaking and harrowing.
London is ahead of the rest of the UK with the coronavirus. They're warning other areas what might happen.
So we have all of these people who are incredibly critically unwell, and people are dying alone. People have no company, they have no comfort, and that's incredibly difficult for the healthcare providers who are trying to help people recover, or in some cases pass away with dignity and kindness. And we are stretched as it is, and that's incredibly hard.
But they're ready for whatever comes next.
Our medical correspondent Fergus Walsh is with me now. The surge has started, is what those young doctors were telling us, and then you see plans for that huge temporary hospital. It really does give you a sense of what is coming.
It does, Sophie. We are at the very early stages still of what looks like being a very major epidemic here, with cases doubling every 5 days. Now, most people will have a mild illness, about 80%, but the numbers from the minority of cases who need hospital treatment, oxygen for pneumonia, they really could have a major impact on the NHS. And a conference centre, an exhibition centre in Docklands being set aside for 4,000 beds gives you a sense of what the NHS is expecting. And the peak of cases may not be until sometime in May.
Europe is very much the epicentre of all this at the moment. What is the global situation then?
So it's worth looking at the global spread of cases. Now, it took 67 days to reach 100,000 confirmed cases, but then it took just another 11 days to reach 200,000 coronavirus cases, then just 4 days to reach 300,000, and then 2 days to hit 400,000 cases. That was today, and that shows, Sophie, the exponential growth of this virus globally, and it's still not stopping.
And the first cases of this were reported almost 3 months ago. What is the situation in China now?
Well, it's really worth looking at the daily reported cases in Hubei province, home to 60 million people. Now, they had their first confirmed case in Wuhan on the 31st of December, and then they went into total lockdown, far stricter than here, on the 23rd of January. But their cases carried on rising for a couple of weeks before the restrictions had an effect. Now, they've been falling ever since then, with only 1 case in the past week. Now, after 2 months, China is going to start lifting those restrictions in Hubei province, and the big question is, have they contained this virus, or will there be a second wave?
Thank you. Well, strict new measures have come into force across the UK for the next 3 weeks, with people being told they can only leave their homes for very limited purposes. You can go shopping for basic necessities such as food and medicine. These trips should be as infrequent as possible. You are allowed 1 form of exercise a day, such as a run, walk or cycle, alone or with people you live with. All gatherings of more than 2 people are banned, apart from your family. You can leave home for any medical need or to care for a vulnerable person. Travel to and from work is allowed, but only where work absolutely cannot be done from home. But there was a warning that those restrictions would be tightened further if people flout the rules. Here's our political editor, Laura Kunsberg.
I live with my husband and my 3 children. I'm also living with the coronavirus.
After struggling with a chest infection, she couldn't shift. Lexi Taylor from Suffolk believes she has the virus and is coping with her 3 kids. She says her husband's being forced to still go to work on the factory floor.
I need him here to support me and to stay indoors like the government have said. Stay at home. Don't go out for anything that's not essential.
This time, journalists were asked online to put questions in number 10. The health secretary began with the quickening pace of the disease.
Very sadly, overnight, 87 more people have died, bringing the total to 422. And our hearts go out to their families and their friends. Yesterday, the Prime Minister announced the most radical steps yet to slow the spread of this virus. And these steps are not requests, they are rules.
We've heard from many members of the public today who are being told that they should go to work by their boss, even though they don't think their work is essential right now at this moment, and they don't feel they can stay safely 2 meters apart from everyone else there. The message to many people has not been that clear from the government. Who are they meant to listen to? Their boss or the advice?
The advice is crystal clear. Go to work where that work can't be done at home. And if you're a key worker, for instance, if you work in the NHS and social care, then you should go to work.
And there was rather unlikely public health advice for couples who don't yet live together.
Test really carefully your strength of feeling. Stay with the household, either together or apart, but keep it that way while we go forward.
A lighter moment maybe, in a serious time when the limits on our lives are growing. Police in Plymouth, politely asking drivers where they're going. So much change already, and this really is hardly the start. Laura Kunsberg, BBC News, Westminster.
Police have been given the task of making sure people stick to the new rules on social distancing. Our home editor, Mark Easton, has been to Watford in Hertfordshire to find out whether people are adapting and complying to the more stringent regime.
The virus patrols were policing the new rules in Watford's High Street today. They don't yet have powers to enforce people to keep their distance or stay at home, but today at least, most seem to want to do the right thing.
So far, everybody's been really good doing what they're being asked to do, because it's safe for everybody's safety and everybody's well-being. So
People seem to be standing quite close together.
they do, and that's what we're trying to move about. If they're in group, if they're 2 and they're family, that's fair enough. But any groups, 3, 4, 5, we are speaking to them. We haven't had any issues, and they are splitting up. But everybody should know by now. They've watched the news, etc. They know.
Well, the government has issued a list of businesses that will be allowed to continue. Supermarkets, petrol stations, post offices, banks, hardware stores, pet shops and bike shops. But many others can't. Leisure centres, beauty salons, car showrooms, betting shops, museums, among others. And there's been some confusion over whether people working in the construction industry and on building sites should carry on working. Judith Moritz reports from Manchester.
Not locking down, but clocking on. These images show construction workers in London crowding together on shift this morning. And building has been continuing around the country.
Self-employed people that are worrying more than that.
In Salford, we found Gary delivering concrete.
I just go from site to site, and I've been on a few sites this morning, and it's just the same wherever you go. There's still people rubbing up against each other, working together, not taking any guidelines, what they've been told. We're trying our best, we carry gloves with us, masks, but it's the other people that you've got to keep educating all the time.
But there's been huge inconsistency. In Leeds, builders on this site downed tools first thing. But on a different site nearby, others were continuing to work.
In Italy, a glimmer of hope tonight, with the number of new infections slowing for the 3rd day in a row. The death toll is still very high. More than 740 people died in the past 24 hours. But tonight, the Italian Prime Minister said he hoped lockdown restrictions could be loosened soon. France, meanwhile, is struggling to keep up with the speed of the pandemic. Intensive care units in eastern France are becoming overwhelmed, with patients having to be transferred to other cities. Our Paris correspondent Lucy Williamson reports.
In places like Mulhouse, it's the very ill who are leaving hospital. Intensive care units here are overflowing, and with dozens more critical cases admitted each day, patients are being sent to Marseille, to Brittany, even to Germany and Switzerland, in a never-ending scramble for beds. And one senior doctor told me that stocks of a key life support drug have virtually run out.
Our health system wasn't ready for this. I'm not sure there's a health system anywhere that's ready for it, because the scale of the crisis is bigger than any system could face. The mechanisms we're putting in place aren't enough.
In the hospital car park, a military field camp has been set up with 30 intensive care beds. Enough to last the hospital here about a day. The government this week tightened quarantine restrictions across the country and introduced a 6-month jail sentence for those who regularly don't comply. The Health Ministry has said the epidemic could start to peak here this week. A doctor working in the heart of the Mulhouse crisis has described it as a huge wave moving west and warned it could saturate hospitals in Paris within days. 5 doctors have so far died from coronavirus. Many more are off sick. The government has ordered 250 million face masks amid anger at a shortage of protection for medical staff.
I protect myself personally with a stock of equipment that we bought for bird flu 7 years ago. It's expired, but we use it because we have nothing else. GPs are given surgical masks instead, which don't protect against anything. It's totally useless.
Each night, residents gather at their windows to applaud the courage of medical staff. Recognition from a nation without immunity that the eye of this epidemic is now travelling across France. Lucy Williamson, BBC News, Paris.
President Trump has declared that coronavirus will kill fewer people than a massive recession or depression, and he says he would love to have America open up by Easter. His comments came as the World Health Organization warned that the United States could become the next epicenter of the pandemic. The death toll has now risen to 677, many of them in New York. Well, Nick Bryant is there for us now. Nick.
Sophie, New York City really has become the centre of the American coronavirus outbreak. The number of cases just skyrocketed here today, and so too did the stock market. The Dow saw its biggest gain in its history in anticipation of a $2 trillion stimulus package being passed on Capitol Hill. Now, the challenge of simultaneously facing a public health crisis and an economic crisis is causing tensions here.
India, a nation of 1.3 billion people, has tonight gone into a complete lockdown lasting at least 3 weeks. India has recorded over 500 positive coronavirus cases and reported 10 deaths. Our Delhi correspondent Arunadhay Mukherjee has more.
With uncertainty looming, India on Tuesday prepared for the worst. In cities, hundreds of commuters looked to finish up last-minute errands as state borders were sealed. Many stranded, struggling to get back home. Once bustling cities slowly turning into ghost towns.
The International Olympic Committee has announced that the Tokyo Games, which were due to begin in July, are to be postponed by a year because of the pandemic.